you were gracious enough when we talked on the phone about trying to schedule this second interview where I said, can I get a list of some patients that had their work done at Altura, the practice which you practice at, you and your associates, and can I get some that have had a final delivery or in almost to get their final delivery stage? And so, man, another brag on you guys. I mean, shoot, that was Friday night at like 6 o'clock, and your team hustled and got that. I had a list by Saturday to be able to, I mean, that's impressive. So good job on your team, by the way.
Thank you.
But I called and I talked to some of them, and that's where they were saying that every month they would come in and have the prosthesis cleaned. And I thought, really? I've never heard of that. And I've interviewed a lot of clinicians, and I've never heard of that. But you're saying because that healing process, when you're in that it is so critical. You're in the osseointegration process that you have the gum level, the connections, everything is well cleaned and well maintained during that healing process. Do you have many patients that continue to come to you on a once a month basis after they get?
Well, the first month is the critical time after the initial surgical appointment. And that first visit at 1 month is very important because that is when they are learning how to clean it, right? And then we spend enough time, our team spend enough time with them, teaching them how to clean these prostheses. And we clean them ourselves, and we polish, we adjust the bite and everything else, whatever new adjustments need to be done, because they're also learning how to function and how to bite with those teeth, right? So I send them home with biting nicely, and then they come back and they bite crooked. They say, what happened? Well, the muscle is getting adapted, right? So I have to make some adjustments in there. So that first visit is critical. From there on, if they are proficient, we schedule another month. And there is a point in time that the patients become very proficient about the hygiene, and they understand what they have in the mouth. At that point in time, we release them and say, okay, first 2 or 3 visits every month, it's okay. You're doing a great job. I'm not getting a lot of impaction of food. Let's release you back until your 6 months appointment, right? Or 4 month appointment, right? And some patients, unfortunately, no. Unfortunately, you know what? Hey, doc, I tried. I have a lack of dexterity. I cannot put my toothbrush very well in there. I use electric brush. I will have a water jet, everything else, and I still cannot get it. Well, those patients need more.
Absolutely.
Hand by hand, right? Hand in hand help. So those are the patients that we monitor. But if you never seen the patient for 6 months after you did the procedure, how do you know the patient is doing a good job or not doing a good job?
It's a great point.
Right?
It's a great point.
And same thing for dentistry in general, right? Dentistry in general, if you have a lot of cavities in your mouth and then you get them fixed and the doctor tells you, okay, I'm gonna have you come back on the often basis to check on you to see if you're not having more cavities, or give you the green lights that come and see me in a year.
Yeah.